So we're going to talk about something different than that we all talked about. And our topic is surgery upside down. So another name for the topic is eye surgery from underneath. 52 years old patient came to me with a sudden drop of vision. He came to my clinic that he actually underwent previous PPV for trauma. He's vitrectomized, and there was an intraocular lens implantation after this surgery, but he suddenly came with a sudden drop of vision. So when I examined the patient, actually when I looked at the patient, the slit lamp examination, what I found was a severely dilated pupil, traumatic mydriasis. Pupil was actually, the iris was atrophied, irregular, and there was aphakia. And I looked at the fundus, the IOL was actually PMMA IOL dropped in the vitreous cavity. So, but the good thing, the eye was vitrectomized. If you look, this is the IOL in the vitreous cavity. The usual approach is actually to send this patient to a vitreous surgeon to do a parasplantar vitrectomy. However, the patient was vitrectomized, and to take the IOL out. This is actually what I did. I referred the patient for the vitreoretinal surgeon to deal with this condition. So the patient disappeared. He actually came to me after a few months. He said, "Doctor, my vision got better. I was praying, and all of a sudden my vision got better. I was praying for God, and then my vision got better." So I looked at the eye. What I found in the slit lamp examination, that the IOL actually came back on the iris. So this is the second condition that I found the IOL came back again to its position. So when I looked, the IOL was not stable. It was in the anterior chamber. It was about to go out again, to go down again. So since this is my specialty, I said, "Come, I will fixate the lens to the iris for you," because that's what I do. I don't do Yemeni. I fixate the IOL to the iris. I took him to the OR right away. And when I take him to the OR, I lie down the patient on his back. This is in OR. So once I prepped and draped in the usual sterile fashion, everything was good. And then I looked at the eye. What I found, actually, the IOL was not there. The IOL dropped again. So again, I asked the patient, "This is not my job anymore. I'll refer you to the vitreoretinal surgeon again to take this IOL out." He begged me to do the surgery because I think it was the problem of the cost that he didn't do the surgery. So I suspected that he didn't do the surgery. I was doing it for free. So what shall I do now? I mean, the next step to think out of the box. And again, I asked him, what I did, I made a wound 2.8 millimeter incision in the cornea. I prepared that wound. And I asked him to pray, but this time under fully sterile condition. So the patient stand up with the fully sterile condition with the speculum in, and the wound, the 2.8 millimeter cornea wound is already there. So if you look, stand up, and patient came on his knee position, knee elbow position. So now I have to do the surgery from underneath, upside down. So he's praying under fully sterile condition. So with the good illumination, I found it was a PMMA IOL. It came back to the anterior chamber, just externalized the haptic to fixate actually in the wound so it doesn't go back again. And I was able to catch the haptic and fix it in the wound that I already did. And then I asked the patient to go back again on his, back. So I was able to do, after I put him back in his back, to fixate the IOL to the iris. I did pupilloplasty because the iris was so atrophied. And that's what I was able to do because the pupil was so damaged. And I fixate the IOL to the iris from the underneath. This is the IOL. And 1 week after the surgery, I saw the patient. His vision was doing very well, 6/12, back when he was counting finger. And the patient was really happy about this. And this surgery, actually, I performed it not recently, 10 years ago. If you look at me, I'm younger over there. So I found him coming back to me a few months ago. He's still doing very well. And thank you very much for your attention.
Thank you.